Unbelievable but true. There is only 2 children admitted in this children's ward at Katakwi District Health Center. Hardly a month ago, the ward, which was built to accommodate 16 patients, was so full to the extent sick children and their caretakers were forced to lay mattresses in the corridors. The congestion was attributed to the high malaria prevalence rate in the district, which was not only draining the district's medical budget, it was straining the health workers.
Budget-wise, the implication is that we spend about almost 80% of our money for drugs on anti-malarials and the IV fluids, like 5% dextrose and so on, buying cannulas. So majority of our budget goes into management of malaria, which leaves other sectors, like say maybe school health, these other prevention programs, environmental health and so on, under budgeted.
Covering a surface area of 2,507 square kilometers, Katakwi district was most affected by last year's floods that hit eastern Uganda. The catastrophe not only destroyed property and 95% of all crops, exposing the population to famine due to food shortage, it provided breeding ground to the mosquitoes, which saw the population battling with malaria. Against this background, Pilgrim, a non-government organization based in Teso, in collaboration with the Ministry of Health and Development partners, launched a campaign in which $2.5 million was earmarked to eliminate malaria out of Katakwi.
The malaria program has an aim of eliminating malaria in sub-Teso region. The Move on Malaria program has been initiated in Katakwi district out of the 7 districts. They carried out epidemiological study in 2007 and found that the prevalence of malaria in Katakwi was highest as to compare to the other districts.
With that high rate, malaria has made it impossible for the people of Katakwi to recover from the effects of the disasters. They are either tending to loved ones in hospital or tending treatment themselves. At the time of launching Move On Malaria program, we met Margaret Ikodet, a single mother of 4, torn between hospital and home.
I brought this child for treatment. She felt sick yesterday night. I've left some at home. I don't know where they are now.
The spraying, which was launched 20th October at Omodi Sub-County by Robert Ekongot, the LC5 chairman, covered 290 villages in all 48 parishes of Katakwi district. The 1-month operation saw 55,916 homes, housing 17,266 people sprayed. In line with the malt-elimination approach program, 45,879 children under 5 years were given duocortexin, a Chinese drug which treats as well as prevents malaria for a period of 1 month.
Giving them is a 1 dose. You take it once and it's enough to help you deal with the parasites in your system. Now for your information, 80% of all the malaria parasites are resident in the human population, and 20% are in the mosquitoes. So if you deal with the parasites in the human population, you will have wiped away 80% of the parasite load in that community. And then you fight the remaining 20% with just your IRS program. And so we all thought and said, in the past, we've all focused on the mosquitoes so much that we've forgotten that 80% of the problem is not on the mosquito, but it's with us, the human beings. So that's why there's this change that let us put the spotlight on the population and try to remove the parasitic load in the people who are alive in that community, and then spend the rest of our time fighting the remaining 20%. That's why we're talking about trying to take care of every person as much as possible, treat them against malaria. That's the logic behind treating every person after giving a test.
According to Pilgrim Management, The mass treatment program was preceded by an epidemiological study which indicated that 50% of the children below 16 years had malaria. In medical terms, if 50% of a population is diagnosed with the disease, it calls for mass treatment. Therefore, all children below 16 years were given the drug, while adults whom tests found to have malaria also received the treatment. The 419 pregnant women who had malaria were referred to health centers who worked in collaboration with Pilgrim to give the right treatment. The program also incorporated mass immunization in which 19,783 children were immunized. Hardly a month after the program was launched, it seems to be yielding results, as health workers in the districts can testify.
Malaria has been a big problem in Katakwi. The prevalence rate in Katakwi was estimated to be around 60%. So you find almost all the OPD attendants, 60% are having malaria, confirmed by laboratory investigation. And the average number of OPD attendance per day is approximately 100 to 200. Since the number was high, but those who are coming with severe malaria were admitted in the wards that I talk. The number of OPD attendants have almost reduced by almost three quarters. As you can see from the waiting room, you don't see patients. Those days we could see patients crowded, even from full in this waiting room, and even outside. You find them waiting to see the clinician. So the number was great. But this strategy, I think, is very good, and I encourage other districts to at least adopt this strategy. Yeah, to me, as a clinician, the way I'm seeing it, I feel now very happy. The number of patients have reduced, so I handle them when I'm relaxed. And those days you are in tension, patients are crowding, they want to see a clinician. And sometimes, if it's late, maybe at coming to 6 there, you have to say, let me only see children. But these days we have to see all of them. And those days some go back without treatment.
The success so far achieved in turning down malaria incidents in Katakwi district is raising hopes that there could be a possibility of eliminating malaria nationwide if a vigilant nationwide exercise is adopted.
This intervention as one of our advocacy tools to convince our government that this is the way to go. We are saying, yes, it's expensive. In fact, what's more expensive compared to, every treatment, say 20,000 whenever you fall sick. So the idea actually in this program is elimination, as you put it. It's ambitious, but achievable. So what we're saying, within this 9 months, we really want to disrupt the cycle of this mosquito, such that at the end of the day, we are really in a state of affair where there was never a mosquito, such that even whatever mosquito is out there is really harmless. So we are saying we really want to continuously advocate, and by doing this, we think the government will be saving much more in the long run compared to treating us all the time. There's an opportunity cost here. Invest once, eliminate, so that that budget which is normally allocated to malaria or other things can do other things. This is really the kind of vision we're having.
Malaria is not a problem in Katakwi alone. It is nationwide and the leading cause of death. 50% of patient admissions under 5 years in Uganda are diagnosed with malaria, leading to an annual death of 110,000 children. It accounts for 40% of all outpatient visits at health facilities.
Malaria does not only lead to the loss of human resource, it is one of the major factors causing poverty in Uganda and Africa generally. It is estimated that 23,000 shillings, about $15, is spent monthly per household on malaria treatment and prevention. Like the Katakwi experience has demonstrated that malaria can be eliminated from Uganda and the continent. That strategy should have been adopted like yesterday. True, like experts have pointed out, the strategy might be expensive in the beginning, but the long-term benefits are incredible. The human population will be more productive. We will save on budget. Saran Sigaye, Katakwi District Health Center.